Well, good morning. I'm from Minnesota, and I haven't seen this much airtime for 6 inches of snow in a long time. But for those of you trying to get out of here today, I feel sorry for you. No question about that. I'd like to start by introducing Mark. Mark Kramer is the co-founder and managing director of FSG. FSG is a wonderful, wonderful consulting organization that's been a great partner with PBI. Mark has written some very influential publications on shared value and catalytic philanthropy, impact investing, and of course collective impact. Mark received his undergraduate degree from Brandeis and then went to Penn and got his MBA at Wharton and his JD, so he's a reformed lawyer, and began his legal career as a law clerk to Judge Rubin on the Fifth Circuit, and then started life as a lawyer in Boston at Ropes & Gray. But he hasn't been in the legal profession for a long time, but he's been making wonderful, wonderful contributions and started FSG. And I'd like to begin by asking you, Mark, about what FSG is and what you do.
Sure. So FSG originally stood for Foundation Strategy Group because when we started about 15 years ago, I and a friend who's a strategy professor at Harvard Business School, Michael Porter, started with the idea that foundations could be much more effective if they really had more data-driven strategies behind their grant-making and programs. And so the original idea was to get some folks from McKinsey and BCG and that kind of background and create a firm that was just focused on the question of how do you use strategy to solve social problems. Since then, it has expanded a lot. We're now about 150 people working all around the world. We continue to work with foundations, but we shortened the name to just FSG because we found we were working with companies, not only on their philanthropy, but on business initiatives, profit-making initiatives that solve social problems, working with governments, working with nonprofits around the world. So it's a very diverse practice at this point. We certainly help launch collective impact initiatives in different parts of the country. But it really is what holds it all together is the question of how do we achieve greater impact with the resources we have in solving the problems that face our world and our society.
And Mark, I know that Esther was extremely struck by the vision that FSG has about the concept of collective impact. And FSG is, as I said, a wonderful partner and is working, and you'll hear actually on a panel discussion tomorrow about PBI's pilot collaborative justice project, and FSG is working on that as well. But can you talk a little bit about what the concept of collective impact is?
Sure. So the concept of collective impact is really about a commitment of important leaders in the community from across sectors, from business, nonprofit, and government, to focus on a specific issue to try and make change at scale. And it involves building a common agenda so that everybody agrees what's the goal here. And that sounds easy, but I've got to tell you it is not. To get business and nonprofits and government to agree on what the goal is can take a year of meeting and negotiation. Secondly, it has a shared measurement system so that everybody working on the issue in a community is measuring things the same way. Just a quick story, there's a wonderful initiative up in Calgary, Canada on homelessness. It's a collective impact initiative. They started out, they hired the local university to collect data. What is being measured? What are all the data points being collected about homelessness in Calgary? They found there were 10,000 different data points being collected between government and each nonprofit and so on. There weren't 10,000 homeless people in Calgary. And through a collective impact initiative, they came together and said, what do we really need to know to track the progress we're making on homelessness? And they came up with 8 measures. And now everybody working on homelessness, everybody touching the issue, is reporting data on the same 8 measures. And you can actually begin to tell what's working and what's not working, and where are we making progress and where are the issues. So a shared measurement system is very important. The third dimension is having what we call a backbone organization. A small group of people, can be only 1 or 2 people, but whose whole job it is to keep this thing moving forward. You know, we all think that collaboration kind of happens naturally, but we all have day jobs that are pretty demanding. And unless someone is holding the collaborative together, is making sure that the meetings happen, the data is collected, it's analyzed, people are following through on the responsibilities they take, it falls apart. And so having this backbone organization that holds it together is essential. Two other dimensions: continuous communication. This is not about a once-a-year meeting. It's about this set of organizations and leaders meeting on a weekly or biweekly or at most a monthly basis for years. And lastly, mutually reinforcing activities. The idea is not that everybody gets together and does the same thing. It's that everybody's doing one part of these incredibly complex systems that touch all of the social issues that are out there. But the parts aren't connected. They aren't mutually reinforcing. They aren't supporting each other. And so it is finding out how what each organization does can begin to reinforce and support the others. And so those are the dimensions of collective impact. And since we wrote the article about 3 or 4 years ago, it has been amazing how this idea has caught on around the world. There are collective impact initiatives in Australia and Israel and Denmark, in Latin America and Canada and the US. And what's even more astonishing is while it takes a year or two for these things to come together, to build trust, to find that agenda, to create the measurement system, within a year or two after that, we're seeing the needle move. We're seeing things, whether it's juvenile justice in New York State, whether it is children's asthma in Dallas, whether it is homelessness in Calgary, we're seeing issues change and circumstances improve because of this collaborative effort that just doesn't otherwise exist.
So, Mark, has the concept of collective impact been controversial in any way? If so, to whom? And what are the obstacles to success of this concept?
Yeah, so the concept itself, I would not say is particularly controversial. It is often, however, misunderstood and very difficult to do. It's become kind of a buzzword, and so people use it for any kind of collaboration because it's sort of the new sexy way to talk about collaborating. And so lots of collective impact initiatives that are called that we see are only nonprofits working together, or funders coming together, or some subset that is not truly cross-sector, doesn't have a shared measurement system, that kind of thing. So first, it's often misused and misunderstood. But second, it is hard. And it's hard because funders want to see quick progress. Right? I've got a one-year grant cycle. I want a proposal that tells me what you're going to do and when you're going to do it by, and I can look at it a year from now and see that it worked. And that's not how collective impact works. It actually achieves very slow progress for the first year or two while the organizations are coming together, while trust is being built. And then the solutions are incremental. And they're significant, but they're incremental. And so it takes a degree of patience, and it sounds like, well, you know, we all ought to be patient, but the reality is foundation program officers need to report to their boards, and public officials need to get reelected, and the timeline that it actually takes to realistically address major social issues over a period of years is actually at odds with the accountability that most people trying to work on these issues face.
So you're a lawyer by training, started your professional career as in a large Boston law firm. Do you think this collective impact approach, which tries to get at root causes and seek systemic solutions rather than maybe addressing case-by-case situations, is something that lawyers can get comfortable with and can actually
absolutely. I think that the skill set and experience of the law is an ideal background to help make this happen. And you know, what we've seen is these are dysfunctional systems, whether it is the criminal justice system, whether it is our healthcare system. These systems are not working together, and a dysfunctional system can last indefinitely. And you can fix individual cases as much as you like without changing the system. And the system can work in such a way that it is in nobody's best interest. It wastes resources. It continues to put people in jeopardy. And it can do that indefinitely until someone begins to change how the system operates. And this is a skill set lawyers have. Because when you bring together a merger agreement, or when you resolve bankruptcy disputes, or when you negotiate a settlement, what you are doing is finding the common agenda among competing parties. And when you put that down on paper and get everything worked out, you have developed, in essence, a common measurement system that everybody buys into as to what we're going to track to determine whether this is working or not. And above all, one of the reasons that collective impact can work is it's not a grassroots phenomenon. You need beneficiaries, you need people who are affected by the system to be part of it, but you need the powerful leaders in the community to be at the table. You need the people who can change the system to be there, or it won't work. And lawyers understand dichotomies and discrepancies in power. They can work with the powerful leaders of the community. They are themselves often powerful leaders in the community. And they can work with those who have no power. And they understand how to bridge that gap and be comfortable at both ends of that spectrum. And so I think that you have the skill set and the position in the community to be a key player in making collective impact initiatives happen and in changing these dysfunctional systems. And you're doing this in Minneapolis, in Minnesota, rather.
We are trying.
We're
exactly.
trying, at an early stage.
Early stage, but a very exciting early stage. Absolutely. We're going to talk much more about that on Friday. When we, as lawyers, and particularly here at PBI, speak about the collective impact approach, we often speak about collaborative justice.
Yes.
Talk to us a little bit about the importance of collaboration and how it works in this concept.
Well, and collaboration, for it to be effective, ultimately depends on trust. And the reason that collective impact takes a year or two to really gel and begin to show results is about how you build trust. We have a system where, companies don't trust nonprofits, nonprofits certainly don't trust companies, nobody trusts government, and everybody thinks the other sector is the problem. And then there's also the fighting for funding. Every nonprofit is struggling to meet their budget, and is this new initiative or these other organizations going to take funding away from me? And if I start to measure my success as an organization on the same criteria and metrics that other organizations do, what if I look bad? So there are a lot of things to overcome to begin to enable the different sectors and different organizations that all touch the same problem to begin working together. And that development of trust and communication and shared data, common knowledge about what's going on in the issue is really critical. I think collaboration is often, driven by goodwill and high hopes. And those two things alone, I'm afraid, are not enough.
So how do we change the paradigm where lawyers tend to work either in isolation or just with themselves to a paradigm where they're regarded as a partner and a collaborator in a larger context dealing with public policy and social issues?
Well, there's certainly a lot of communities out in the world where the thought of trust and lawyers don't naturally go together. So there is a little bit of something to overcome there. But I think, you can't stop representing people pro bono who need representation. The system is not going to change overnight, and those needs are urgent and need to be met. But you also have to recognize that that is not changing the system. And you can do 4.3 million hours of pro bono or 8.6 million hours or whatever it is, and you can keep doing it year after year after year, and the need is only going to increase. and the gap is not going to be closed. So the question is, can you take some portion of your time and focus it on a new way of thinking about pro bono? Pro bono that is not about an individual client, but pro bono that is about changing the way your community addresses a critical social issue, whether it's homelessness, whether it's poverty, whether it's healthcare, whether it is crime. And what is most exciting is that while it is a tough slog, honestly, it's probably easier than defending some of the pro bono cases you're defending. While it's a tough slog, you begin to see progress. And that gives people a sense of hope. And there are so many people out there working so hard on issues, whether it's representing individual clients or nonprofits working on issues more broadly, that don't have a whole lot of hope because they've been doing the same thing for decades and they haven't seen it change. And once you begin to see little things change, and we talk as we're helping launch collective impact initiatives about the idea of quick wins, because part of what holds this together is showing progress. You may not have solved the issue, but there's some dimension of it that you're seeing the needle move on. And for many people, that's often the first time, for all the years they've worked on an issue, that they've seen actual measurable progress. And that is immensely rewarding. And so I think it takes a different way of thinking about your role as pro bono lawyers in the community. But I think it taps a skill set you have. I think it takes perseverance that I know you have or you wouldn't be here. And I think you'll find it can be quite rewarding and really a very, very powerful leadership role that you can begin to play in the community that reflects well on you and reflects well on your firm by taking this on.
And I do think, Mark, it's part of lawyers' DNA to, if you look in the litigation context, we work with experts, with people who know more about various things all the time. In the transactional area, you're bringing in experts in certain aspects of a deal. So we do need to collaborate and do it as part of our professional work, part of our representation. So the notion of then expanding that to think systemically about issues with people who maybe have passion about things but have been working in isolation, to now do it in a collaborative fashion to bring all of those resources to bear is really exciting. And that's what we're finding in this nascent effort that we've got underway in Minnesota.
Absolutely, you're right. And it really, there are a lot of groups out there that sort of facilitate gatherings. And there's a great skill set there, and lawyers have it. But a lot of facilitators are not sort of goal-directed sufficiently to not only make sure people get along in the room, but that they make progress toward an outcome. And what it takes, we've seen in collective impact, is to be able to facilitate people who come from very different directions. I mean, we worked with the state of New York on juvenile justice system, and we had chiefs of police, and we had school superintendents, and we had, ACLU and other representatives who were suing the police, and all at the same table. It is not an easy facilitation process. But it takes facilitation that is goal-directed and that gets people to move and make progress and come to an agreement. And again, this is a skill set that lawyers have all the time and draw on all the time. And I think just as the Solicitor General talked about how his work with habeas cases helped him in his professional development at his career, I think that the facilitation and negotiation skills that are needed to bring a community together around a collective impact initiative are tremendously powerful skills for any lawyer to develop and hone.
Mark, you've talked about some of the efforts that FSG has been active in. Can you talk a little bit about the successes you've seen so far and how it's worked?
Well, I know my colleagues, Val and Aaron, will be here with you tomorrow, and they'll talk a little bit about work we've done around substance abuse in Staten Island, which has had a measurable impact. But, two of the most exciting cases we've worked on, one has been this juvenile justice system in the state of New York. The state of New York, very broken, dysfunctional juvenile justice system. You can fall into it because of a serious crime, or you can fall into it because of truancy. You missed school. And once you're in it, it is absolutely arbitrary, whether you get sent home with a slap on the wrist or you end up in prison in upstate New York. And if you end up in prison in upstate New York, the state of New York is spending $250,000 a year on you. And the odds of you going back to prison after you're released are 90%. That's the recidivism rate. Completely dysfunctional system. And we brought together all of these different people. And, in New York, it's every county. It is an incredibly intricate and complicated system that touches parole officers and prison officials and police officers and school officials and government officials. And the backbone was really organized out of the governor's office. And there was a deputy who was appointed to be in charge of this full time. And it took about a year or a year and a half to come up with a common agenda, to be able to agree what we're trying to accomplish here between the police interest in getting dangerous people off the street, the school's interest in seeing children succeed, and so on. But what we've seen is that there was no common data. There was no sharing of information about the number of juveniles being arrested, what happens to them once they go into a system, how many of them go to prison, how many of them go to different places. What we found was there was a very well-tested mechanism for a judge to assess whether a juvenile offender in front of him was likely to be dangerous. Prior to this, judges really had sort of a binary option. They could put the kid in prison or send him home. But it turns out there's a range of other solutions that are possible if there is a validated mechanism that enables a judge to feel confident that he's not letting loose someone who could be a danger to the community. And it turns out that there are options to police other than just arresting a kid or letting the kid go. What seemed to be binary turns out to be a continuum. And the result, 3 years later, there's now quarterly data that every agency that touches these kids looks at and is trying to work to improve the same metrics. The number of kids in state institutions is down 45% in 3 years. The number of arrests is down 25% without the crime rate going up. We got legislation passed so that if a kid is arrested in New York City near their home, they're going to be imprisoned in New York City near their home if they end up in prison. Previously, they were sent to upstate New York, and there is very clear evidence that if a kid is in prison nearer to family and friends, the recidivism rate is lower than if they are isolated with criminals in upstate New York where their parents can't visit them. And so what we found is with a policy change, with better data and communication across all the different departments and organizations that affect this issue, there is a common goal, and we can make real progress. I'll give you one other quick example. We've been working with the Children's Hospital in Dallas. One of the consequences of the Affordable Care Act, if it remains, is that it has incentivized hospitals to care about the health of people after they leave the hospital, so they aren't readmitted. And so hospitals are thinking more and more about health in the community, not just what happens inside their four walls. And so the Dallas Children's Hospital brought FSG in to help create a collective impact initiative around children's asthma, which is the big expense, the main reason children end up in emergency rooms, and a huge cost. And so we got the insurance companies together and all the different hospitals together and school nurses and everybody and began to create these working groups focused on different aspects of the issue. And of course, there was no data. Every hospital has its own data, but they don't communicate. So nobody actually knew how many kids end up in emergency rooms for asthma in Dallas, when they show up, and so on. And somebody from the insurance company said, well, I'm sure that these kids end up in emergency rooms because the local clinics are closed. There's nowhere else for them to go. So maybe if we had clinics open more, that would help. Well, we actually were able to get all the data because everybody was part of this initiative. And it turns out the peak time for admission is 10 a.m. Monday morning. And they said, why are kids going to the hospital 10 a.m. Monday morning? And the school nurse said, well, I could have told you that, because we manage their asthma all week. They go home. There are all kinds of triggers at home. There's dirt, there's pets, there's parents don't know how to use inhalers. They don't keep the kids' medication properly. And the kid shows up Monday morning in crisis, and there's nothing we can do but send them to the emergency room. Well, immediately the hospital says, well, we can give you the stuff to treat the kid at school, at the clinic at school. You don't have to send them to the emergency room. Oh. Well, all of a sudden, kids aren't being yanked out of school every Monday and having their education ruined. And insurers aren't having to pay for emergency room visits. And hospitals aren't having to pay for indigent kids showing up in emergency rooms. The cost savings and the human benefits are extraordinary from a simple change, just because there was no communication, there was no data, nobody knew. And what we're seeing again and again is this is how collective impact works. It's not that there's a magic solution that all of a sudden everybody agrees on and puts in place. It's that there are all these little dysfunctionalities from the isolated efforts and lack of knowledge and data and communication in these systems. And when you begin to bring people together and hold them together and get them to see the same data in the same way, there are little fixes, countless little fixes that can happen, that people figure out for themselves, that fundamentally change how the system operates. And that is the power of collective impact. And whether it's in education, and there are wonderful initiatives we're working on in K-12 education in Seattle, whether it's juvenile justice, we're now working in Nebraska on their juvenile justice system, whether it's healthcare, whatever these issues are, these large complex issues, we've seen that real progress can be made by using this tool.
Can lawyers make a difference and add value using this type of approach?
Absolutely. As I've said, there is this very unusual skill set that is needed to bring people together across these dichotomies of power, across these interests, to find the common ground, to facilitate the meetings that are sometimes rather explosive in a way that gets to results, doesn't just make people feel okay, and to analyze data and figure out what that data means, to work with people at all levels and stages of the community, and to have the clout within a community to assemble the leaders, the people who are the heads of the school system, the mayor, the heads of the CEOs of the major corporations in the city, the head of United Way. You need the people in leadership to be able to make the changes to the system. And again, all of these qualities are things that I think lawyers are uniquely positioned to bring about, to use, to exercise, to make happen. And so I think that as critical as the individual representation in pro bono is, and that's what we think about when we think about pro bono, this role, which is really for the common good, the common pro bono, is, I think, a tremendously powerful and rewarding role for lawyers to play. There is a system set up so that when you volunteer for pro bono service for an individual client, a case will come to you, you know what to do. It's not as easy to start a collective impact initiative. The path is not laid out for you. There's not going to be an automatic case that comes to your door. So it takes some work to find this new path and this new way of doing pro bono work in the world. But lawyers can certainly do it and can be absolutely critical in making these things succeed. I mean, I do consulting now, our firm does consulting, but it's certainly my training as a lawyer that I draw on when I am asked to help facilitate or lead a collective impact initiative. This is the skill set we need. You have it. And you can make a much more transformative difference in your community and on the social issues that really matter to you personally by taking on this larger role than just the individual representation.
As you will all hear more about tomorrow, It is not easy, but it's terrifically exciting. Mark, thank you so much for all you've done, for all FSG is doing.
Jim, thank you.
Absolutely.
Thank you. Pleasure to be here.